Hi everybody, it's Simon Ramshaw here, Managing Director of Erchonia Lasers, UK-based company representing US-based Erchonia Corporation in Europe, Middle East and Africa. I'm going to leave a message in the chat to see whether people can hear me, because I've been having a few issues. Speaking of Dr. Silverman, he can't hear me, but I can hear him. So can any of you leave messages actually as well in the questions to see if you can hear me? That would be appreciated.
And we'll double check, make sure everybody can hear us. So let us know. Can you hear Simon? Can you hear Rob?
Oh, Stasha's come on saying she can hear me fine. So that's all good. But you can only hear me through the phone, Rob, is that correct?
Yes. That is correct. Can they hear me?
Yeah, I can hear you via the laptop. So you're just gonna I'm gonna keep the phone on so that you can hear me through the phone.
I think that's fine.
Okay.
I'll repeat the question anyway, so I get it straight in my own head.
If anybody has any issues hearing, please let us know on the question element on the right-hand side. It appears everybody can hear me, but Dr. Rob can't hear me, whether it's something to do with the transatlantic link-up. I don't know, maybe it's because we beat the US in the Ryder Cup. There's some sort of bugs
and the US is behaving
between the both. But look, thank you very much, everybody, for coming on. We wanted to keep this relatively informal, so rather than having, a proper presentation, we thought like a questions and answers session would actually work pretty well. So some of you will be very aware of the skill set of Dr. Rob Silverman. He's been involved with us in Europe since probably 2018 now, for 7 or 8 years. I've got to know him so well over the years. He's a close personal friend, as well as a very much well-respected chiropractic doctor who is responsible for all of our training and support programs. There's a lot more education and knowledge about non-thermal high energy laser over the pond in the US. So when I launched these lasers into the UK and Europe back in 2020-ish, we obviously wanted somebody who had a lot of experience and could help share that experience. So Dr. Rob, as well as some of his peers, but especially Dr. Rob, has been at the forefront of that, and we thank him very much for that. And he is also responsible for the training programs that we put together to try to make the integration of the lasers into clinical practice the easiest possible route forward. So I will introduce you to Dr. Rob and go through a little bit of his bio before handing over to him to say hello. He's a pioneer and functional medicine specialist, award-winning chiropractor, globally recognized speaker, and we can vouch for that because we've had him over here probably about a dozen times. Based in New York, Dr. Silverman holds 6 degrees in nutrition and directs an innovative, integrative health center dedicated to performance, recovery, and longevity. He's the author of the Amazon best-selling book, Immune Reboot, and a pioneering voice in the fields of gut-brain health, metabolic optimization, and laser therapy. A frequent presenter at top conferences worldwide, Dr. Rob combines science, clinical insight, and practical strategies to empower both practitioners and patients. When he's not speaking or writing, you'll find him staying active on the basketball court. If he was able to stand vertically, you would see he's got a basketball player's frame. Or sharing evidence-based health insights with over 700,000 social media followers. I think I've got 700, Rob, so you're doing very well with 700,000.
I appreciate that. I'm willing to share.
Dr. Rob is here to deliver real actionable knowledge, so obviously take any notes you need. You know how the questions section works if you look at the right-hand side. So I'm going to be asking some questions that we've had coming in from some of our practitioners. Any further questions, please put in the questions section and I will answer them as we go. But to start with, Dr. Rob, welcome. Always a pleasure.
It's my pleasure to be here. I'm excited about chatting with your particular practitioners. And I'm also excited about the idea of really previewing our in-person in November in Windsor. You know, an interesting thing about Windsor was I gave a promotional video and I made the comment that Windsor's right outside of London. So we've had a whole debate about what is considered outside London. So when I come, I want everybody to chime in on that, because I'm very curious, because if I say I live right outside Manhattan, it could be 90 minutes. And I have the same feeling that's holding true for Windsor and London.
Well, Rob, I'm up in Newcastle, so I'm definitely outside of London. Okay, well, let's crack on. We had a soft media launch in London last week where we had around 10 journalists, and we were talking about longevity and brain health and a new program we've developed for clinics called the Rainbow Reset program. And it's very specific to integrating both red, green and violet visible light into any sort of integrative setting, from medical aesthetics to longevity clinics, to obesity clinics, to gynecology clinics, to chiropractic, osteopath. There's so many different areas that we can provide a solution which can work well with the skill set of the doctor or the practitioner. So that went down extremely well. A lot of journalists as well weren't really understanding what the difference is between non-thermal high energy laser and the red light therapy or infrared or whatever you want to call it. So we had a lot of fun educating them, and at the end of it, I think each and every one of them were absolutely astounded. How this laser works, it's like day and night compared to what everybody thinks they know about laser. So hopefully at the end of this this webinar, you'll be in a better position to understand. So I'll start with the first question, and this is a very generic as well. It's not just specific to lasers. It's looking at the bigger picture of longevity and wellness. So Rob, are you ready?
Locked and loaded, my friend.
First question, how do we define longevity?
That's a great way to start, because it is without question the insightful conversation of 2025. It has been the top of everybody's mind since 2023, 2024. Longevity, simply put, is a lifespan versus health span. Lifespan is how long you live. Health span is how long you live without chronic disease. Now, I'm going to give you American numbers because we are first in chronic disease, and I don't mean ameliorating it. I'm talking about acquiring it. The UK, you guys are a little bit of laggards. You're number 3 or 4, depending on what list we see. So much so that our 2 main state-run organizations or federal-run organizations vary from 86 to 98 cents per dollar in healthcare. So chronic disease is a problem. 6 out of 10 Americans have 1 chronic disease. 4 out of 10 Americans have 2 chronic disease. Again, the UK is quite close, right behind us. So the idea of attenuating chronic disease is at the forefront, but we have a lifespan versus health span. I believe that we should have the white cloud behind both of them, and that's vitality. What I mean by vitality is to be violent enough to come meet you, get off the plane, and have a nice, good cup of coffee, talk about laser, talk about life, and go the next morning and give a lecture. That's vitality. And hopefully that evening, have a dinner with my wife. So it's lifespan versus health span, adding in the concept of longevity. Laser fits in all 3 of those buckets.
Brilliant, Rob. Thanks for that one. I'll crack on straight away with question number 2. Can you discuss the hallmarks of aging, please?
Yeah, the hallmarks of aging. This really sets the table to why we use symbiotically nutrition and lifestyle and low-level laser therapy. So some of the hallmarks of aging are very interesting in that we talk about inflammation, the increase in inflammation or inflammation inside the body, which we call inflammaging. Time magazine thought so much of inflammation 20 years ago, it put it on the cover. The current idea is inflammaging. So we want to manage and modulate inflammation. What better way to do that than use a FDA cleared, non-thermal, low-level laser, which has been proven in blood tests to decrease inflammation. Decreases it by increasing interleukin 10. Now, most people think that the idea of a release of an interleukin is pro-inflammatory. There's 17 interleukins, 13 are pro-inflammatory, 4 are anti-inflammatory. The winner of the anti-inflammatory interleukin is interleukin 10. Interleukin 10 also conversely decreases NF-kappa B, interleukin 1 beta, interleukin 6, and interleukin 8. So the usage of laser has an effect on the body from the inside, proven by blood tests. So that's one major hallmark of aging. Another one is the microbiome. We all talk about the gut microbiome. I believe the gut is the epicenter of your health. 80% of your immune cells are in the gut. It's where your macro and micronutrients are absorbed. I believe that everybody would benefit from taking better care of your gut through lifestyle and using our gut laser protocol, which I will demonstrate before we leave today's webinar. Now, in addition to that, one little thing coming down the pike is the gum microbiome. So there's good data to indicate how the gum microbiome leads you down a path towards Alzheimer's. And once again, low-level laser, yep, exactly. I've got mine right here.
I've been having a few vocal issues, so I thought if it's good enough for John Bon Jovi to use, it's good enough for me. So I'm just lasering my throat.
Right. The idea of John, I've had a little trouble hearing you, but I heard Bon Jovi. But remember, Bon Jovi's from New Jersey. That's like coming from Newcastle. I'm from New York. Don't confuse it. But to your point about hallmarks of aging and performance, obviously Bon Jovi needs to sing. He's known as an elite rock and roll singer, and he used the Erchonia laser to get his voice box back because he had some atrophy in the voice box. So he lasered it just like you did. I happen to recommend lasering to the mouth to decrease the incidence of gingivitis. Gingivitis produces a bacteria called gingivalis, which produces a destructive enzyme called gingerpans. Gingerpans is common in 90% of Alzheimer's patients. So this hallmark of aging really, again, can be decreased by the usage of non-thermal, low-level laser, the device of now.
Okay, Rob, thanks for that. For anybody who can hear my voice echoing, it's because I'm having to speak to Dr. Rob through the phone because he can't hear me through the laptop. So anybody, apologies about that. Okay, so that's the whole.
Come on, who doesn't want to hear you speak twice?
What are the biomarkers for longevity?
Well, I have a list of 15 biomarkers. So let me give you a couple of the big ones off that list mentally. Number one, a biomarker. Every practitioner should test for this. They should test for interleukins, interleukin 1 beta, as we said before, interleukin 6, interleukin 8, and TNF alpha. These are critical inflammatory markers. Did you know that they reveal more damage to your lumbar spine than an MRI? So amazing when you look at that. So these are immense markers of inflammation. C-reactive protein tissue inflammation is also a critical add to a marker of aging, a great biomarker. Also, hemoglobin A1C. So our markers are different than yours in the UK, but hemoglobin A1C really depicts whether you have pre-diabetes. And you want to avoid that because without question, the most inflammatory consideration or inflammatory blood marker is fasting glucose, hemoglobin A1C, elevated blood sugar, and elevated levels of insulin. It is not cholesterol markers, but if you want a cholesterol marker, the big one would be ApoB. ApoB is the Titanic. It's floating down the big ocean, looking at the iceberg. Underneath the ApoB would be 3 different demographics of people on the Titanic. That would be VLDL, LDL, and LP(a). LP(a), make note, is critical in that is your genetic heart attack marker. One other marker that I would make note of, a genetic marker, would be ApoE. So there's 3 variants to ApoE. ApoE2, 1% of the population has it. If you have ApoE2, you'll never see Alzheimer's. ApoE3, 75% of the people tested means that you're in neutral. If you have a good health, if you have a good lifestyle, you will avoid Alzheimer's. If you don't, you're backing up your health truck into Alzheimer's. If you have ApoE4, you have a genetic predilection for Alzheimer's. If you have two markers or two alleles of ApoE4, you have 8 to 10 times the chance of getting Alzheimer's. The actor who plays Thor has the double E, and he is absolutely in good condition. He watches his diet, and he said that he's even going to do more because he wants to be able to get to the situation that I'm in, where I'm neutral on both my parents or both alleles. So Alzheimer's is a real concern. Just to take it to the next step, there are nutritional protocols for Alzheimer's called the RECO program that stop and reverse mild to moderate Alzheimer's. I had Dale Bredesen on my podcast, which you alluded to. I have a big social media following. There is robust studies on lasering the brain and lasering the gut to help decrease the incidence of Alzheimer's and go in conjunction with preventing, slowing down, reversing mild to moderate osteoarthritis. One little practitioner note, all neurodegenerative disease, Alzheimer's is a neurodegenerative disease, originates in the gut. Once again, if you have 3 protocols to do, everybody when they leave today should know how to laser the gut, laser the vagus nerve, and laser the brain. Everybody should know that. And today's extra bonus is going to be the rainbow reset. By the way, I like it so much, I coined it. I recoined it for you. It's called Rob's Rainbow Reset, the 3R program, where light meets longevity. Oops, I'm sorry. That was very American, but
we'll send you the invoice.
That's no problem. I'll send you back in American dollars.
No, but you brought up some very good points there. I think, you know, we're not saying that all you need is laser. I think in most professions, everybody looks down the road of combination treatments, and you know, you can have as much laser as you want, but unless you're doing the right things in your lifestyle and with your diet, you're never going to achieve your own longevity. I think that's got to be the main point to the majority of people. And unfortunately, we live in a society, Rob, where too many people, including me, sometimes look for a quick fix. They want to do the minimal amount of effort to get the maximum amount of results, and unfortunately, that's just not possible when it comes to this.
Agreed. And you know, I think it's time, you know, to share the spoiler alert to piggyback on what you said. Laser works fabulously alone by itself, but it's synergistic with other practitioner chiropractic protocols and most synergistic with nutrition and lifestyle. Let's look at the mitochondria. So everybody knows the real reason that we do the rainbow reset is because we're using 3 different wavelengths to stimulate mitochondria. Mitochondria has 4 complexes. Obviously, they're named complex 1, 2, 3, and 4. So the violet light stimulates complex 1 and 2. The green light stimulates complex 3. And the red light closes the deal by stimulating complex 4, allowing for efficient ATP production and a decreased release of reactive oxygen species. So it's efficient at increasing energy and also efficient in decreasing aging, if you will. Now, what's most interesting is it has a direct photonic effect. So not to pick on it, but we'll talk about methylene blue. It was just in a big reel everybody was talking about. Methylene blue has an effect. I don't use it because it's a dye. Methylene blue has a positive effect on mitochondria. But to speak to that, it does it by rerouting and stimulating nutrients and then allowing it to substitute with photons. The laser is direct. So the laser is your best choice, but laser with a NADH, laser with coenzyme Q10, laser with L-carnitine, now that's your secret sauce without question. So I just wanted to say that nutrition with laser is the 2 handshakes of health. Nutrition, laser, my handshake of health. And I'm happy you said that.
That was going to be my next question to you, because obviously, as we alluded to at the start of the call, you've got 6 degrees in nutrition. So, you know, I think, I know you do your best. You check on, when you go to restaurants, you check on, you know, as much as you can, what's in the foods. Is it organic? Is it not organic? There's so many preservatives and additives in food. You don't drink alcohol, but many of us do. So all of these things combined are adding up to, you know, depleting our mitochondrial function, depleting our cellular function. which is obviously having a huge impact on longevity. So what sort of nutritional supplements, Rob, do you use or do you recommend when you're talking about treating clients of yours for longevity purposes?
You know, longevity in mitochondria, I think that mitochondria dysfunction is the black cloud where Darth Vader comes out and damages our longevity, because mitochondria dysfunction is the backbone of neurodegenerative disease. Our number one mitochondrial organ is our brain. Our second one's the heart and the kidneys. So obviously, if these aren't functioning well, it poses a problem. When you look at your rainbow reset or Rob's new rainbow reset, you're looking at vagus nerve, brain, you're looking at gut, and you're looking at cellular vitality at the kidneys and adrenals. You're basically looking at mitochondrial reset. So some of the things I would recommend beyond laser and exercise. Exercise is critical, of course. Muscle mass is critical. So I do believe in weight resistance. I believe in a whole food diet. I know everybody is carnivore, a vegan, Mediterranean dash, it's all good. As long as Simon and I go out and the food is whole food and it hasn't been adulterated, it is a good choice. So fruits and vegetables, grass-fed beef, wild fish. You know, it's very funny. I realize I speak very American because I say grass-fed beef. I say wild fish. I say no ultra-processed foods. Because I was just in the Açores in Portugal and I inquired in the restaurant, is it grass-fed beef? And the guy looked at me and he basically said, you dumb American, what else do cows eat?
Yeah. There's a lot, well, it goes back to what we just said before, there's a lot of education needed. And I know mostly myself, I mean, we've discussed before about what they put into US foods, and you said they're a lot worse than what they put into UK foods. But even when I go to Italy, I've been quite a bit recently to the likes of Lake Garda. I've been to Florence a couple of times, and the issues I have with my gut when I go to a British restaurant are never as bad as when I go to an Italian restaurant in Italy, because it does seem to be that they aren't as reliant on the preservatives and additives that the rest of us are.
Oh yeah, I agree. So, you know, you're talking about how Italy is cleaner in their pasta than the UK. Imagine coming to America where the gluten has been hybridized and the soils have been damaged with glyphosate, a cancer-causing product having Roundup in it. So again, the idea is you want food in its purest form, and you want to be able to eat whole foods 2 to 3 times a day. You want to incorporate an intermittent fast of 12 to 16 hours daily. None of these 3 or 5 day fasts, I don't buy that. I think that we should be eating every day or most every day. Maybe once in a blue, we take a whole day off from food. You combine that with exercise, a proper lifestyle, and add the device of now, the non-thermal low-level laser. I think that you're adding years to your life. If you want to supplemental years, here you go. If you take 2 grams of omega-3 fish oils, you'll add 5 years to your lifespan, healthy lifespan. If you take 2,000 IUs of vitamin D, you'll add 3 years of healthy lifespan. Combined, if you start your patients now on omega-3 fatty acids and vitamin D3 with K2, which the body has a receptor site on every cell for omega-3 and vitamin D3, you're adding 8 years to the lifespan. Then you couple that by using the device of longevity, non-thermal low-level laser. I mean, you're talking about adding a decade to somebody's life. Now at 60, believe me, you give me 10 more years of health over what I would normally get, you are my friend. Money is no object. Compliance is there.
No, I agree. I agree completely, and we're all aware in this day and age that we're all living longer, but we're living longer with chronic disease, and the 10 years of life you're talking about there, normally the last 10 years of our lives were being managed by pharmaceutical drugs. And, you know, I think people think sometimes, oh, when I get to that age, I'll worry about it then I'll start making the changes. It's like, no, you start making the changes now.
There are 2 things I have to say. There is no lottery ticket for health. It's work. Number 2, do you start on your retirement fund when you retire, or do you start prior to your retirement fund? So obviously you're a savvy guy. You're going to say, I've been working on a retirement since 25. You have to ask yourself, what about your health retirement? I mean, the whole purpose to retire is to be able to enjoy your life. You know, it's been said that a healthy man wants 1,000 things. A sick man wants only one. He wants to be healthy.
Yeah, no, completely go along with that. But this again, everything that you're talking about here, from non-thermal high energy to nutrition to lifestyle changes, it goes back to that comment I said earlier on, which basically stated we are born with everything that we need to actually live a long, healthy life. It's these deviants that we keep taking by way of our lifestyle choices. And look, I know that, you know, people want to enjoy their lives, and there's a lot of nice things in this life that, you know, aren't very good for you. But with a lot of people, I think it's just a case of getting a balance. You know, I know you're dedicated to your health. That's how you go about your everyday life. But I think the rest of us, it's maybe just a case of gradually making some sacrifices, and then as time goes on, making a few more, because it's like repetition, right? The more your body gets used to you not living a good lifestyle, the more that will continue. But as you start making these changes to your life, it will become easier to keep those changes going on a longer term basis.
I like the nuance in your vernacular, because you went from sacrifices to changes in a paragraph. And I was going to say that's it. It's just some necessary changes. Remember, health is wealth. It's just a change. You know, many of my patients come in and ask me, but if I eat healthy, it's not going to taste good. That's not true. Healthy food tastes good. What do you have to lose by eating healthy? Nothing. You have everything to gain. And again, the idea of health, nutrition, proper supplementation, exercise, chiropractic, naturopathic, regenerative care leads to longevity. You add in the device of longevity laser. I mean, the formula is there for everybody who's listening now and everybody who's going to come on November 2nd to Windsor.
Yeah, definitely. I think, and we've discussed obviously non-thermal high energy laser. We've demonstrated it there. You're only too aware this side of the pond. There hasn't been as much education and as much knowledge as you actually have over in the US. We have a lot of antiquated guidelines like WALT, which is 20, 30 years behind, and it hasn't evolved as other technologies evolve. And because we've been less regulated in Europe, we get flooded with a lot of extremely average technologies who make false marketing statements, who provide clinical data that looks good, but if you look into the clinical data, it's not level 1 gold standard, it's not randomized, it's not double-blind, placebo-controlled. And one thing about Erchonia, when I first came across them in 2012, I looked at their research and I was trying to pick holes in it. But I realized over time, they don't take anything to chance, and they put their money where their mouths are. And they spend around $1 million on every one of their level 1 controlled studies that they put forward for US FDA clearances. So as much as we don't go by the FDA over here, we still use it as a stamp of credibility, because to get a CE mark, Rob, if you remember, you only have to prove safety and not efficacy. So people sometimes walk past the exhibition stand, or my team are at exhibitions. They think they know what it is, but they have no idea. Can you define the differences between non-thermal high energy laser and the likes of red light therapy, which can incorporate infrared and LED?
That is probably the most asked question. But before I tackle the easy answer with that, let me piggyback a little bit on what you said when it came to the FDA. So having done as a lead clinical investigator 2 FDA cleared lasers, therapy studies, it was an arduous event. We had to document everything. We had to prove everything. We had to reprove, double blind, the whole bit. So it's basically, when you look at the FDA, as somebody who's done a study for a period of time, invested money and effort, versus somebody who's just bloviatingly saying, my laser works. So it's a difference maker. Now, as far as the red light therapy versus non-thermal low-level laser, you know, I can woo you with the science. Let's just get to one major point. The LEDs, light emitted diodes, not a real laser, they generate heat. So number one, I don't want to generate heat because I want to use my laser on the brain. Obviously, if you make a brain hot, it's a fever. I don't want to elevate a nerve. It'll cause inflammation. I don't want to elevate a gut. Non-thermal low level laser is effective and efficient for all different dynamics. But here's the big one. Here's the little analogy, metaphor, if you will. It's incoherent light in LED versus coherent light. So the way I look at it is, I used to work as a bartender. The drunk, he was incoherent. He could not communicate with me. So the laser is not communicating with you if it's an LED. Whereas the laser that Erchonia uses, the non-thermal laser, is coherent. It's an Oxford grad wearing a suit who's delivering a perfect conversation to you where it's crystal clear. Incoherent versus coherent. If you want an LED, so be it. It's a good heating source. If you want a non-thermal low-level laser, it's a health and longevity source.
No, that's a very good explanation. And, you know, there's probably, I know on this call, there's probably quite a few of our existing clients as well as practitioners and doctors who haven't had a non-thermal high energy laser. But people probably say, well, what are you talking about? LED, it's heat, it's not heat, you can't feel anything. Now, can you go a little bit into the studies that have gone on at Harvard, which showed only visible light actually has the necessary levels of energy per photon to deliver a photochemical response? And that's only at specific parameters as well.
Right, you're speaking precisely about the wavelength, which is the constant, which is the key to outcome. So you want a wavelength of anything less than 720. The red light that the Erchonia uses is a 640 wavelength, just to round up or down a little bit, and that produces 1.9 electron volts. When you get down to the green wavelength, which is 520, it produces 2.4 to 2.6 electron volts. And when you go to 405, the violet light, you're producing over 3 electron volts. What's the issue? You cannot have a positive effect to the mitochondria below 1.7 electron volts. So if you have a wavelength of more than 720, which is common in a lot of the red LEDs, you don't have enough energy to have a response, or like you said, a photochemical response. So photons stimulate a chemical reaction. If they're unable to stimulate a chemical reaction, they're going to stimulate a photothermal reaction. And we know in many instances, heat is deleterious.
Yeah, I mean, you know, I think also as well, you know, we've talked about LED and infrared. You know, I can, for example, I can make one of these lasers that look like this. I could make it with LEDs rather than laser diodes. And that's what are used in the research. So it is double blind, so the doctor and the participant, the patient, don't know which is which. But that's a great analogy as well, you said before, about the drunk, because, you know, I explain it specifically with the lasers. You know, if I was shining an LED on my hand there, because it's a non-coherent light, as soon as the energy hits the light, hits the skin, the energy scatters. So by the time it reaches the mitochondria, it hasn't got enough energy to create a photochemical response and deliver that minimum 1.7 electron volts per photon that Dr. Rob was talking about before. So there's only one thing that happens, even though it's LED, you know, the energy comes into contact with the water molecules, makes them vibrate and creates heat, even though it's a mild heat. So it's understanding the differences between photochemical, which works more like a drug than it does a laser, even though it's under the laser umbrella, and photothermal, which most would tend to associate with infrared, then up to ND-YAG type devices. So I just wanted to confirm that.
Yeah, and
okay,
the idea of photochemical, Simon, not to interrupt you.
Again?
The idea of photochemical is photosynthesis. So what works for patients is this laser mimics photosynthesis of the body. Everybody understands that because they've all learned photosynthesis in 7th grade or something of that nature. So that's number one. Number two, to give you an example of the idea of direct and coherent and scatter, think of the game paintball. I mean, you guys have paintball there where you shoot your friend with paint. Think of it with a LED. It's all over the place. It's like a mess, but it didn't hurt him. It just splattered him. Whereas if I have a non-thermal low-level Erchonia paintball, it's direct, it's precise, it's a direct hit. It gets in. It kind of mimics a injection in that it's precise. So the scatter doesn't allow for effectiveness, the coherence does. And one other thing, and we don't talk about this enough, is that the laser has a line generated beam. So the line generated beam adds to its coherence, adds to its understanding. The understanding meaning the ability of the body to absorb the photonic energy. The lower the wavelength, the more electromagnetic transfer of energy.
Yeah, good explanation. We're using a lot more analogies now, especially when it comes to trying to be on the level that patients and clients are that go into the clinics, and coming up with something that they understand. And it's so simple, it's just ridiculous, isn't it? You know, we've talked about this sort of thing for years with regard to the effect light has on plants to help it heal and to help them grow. You know, some clinics of ours are even using analogies like, you know, when you're using your mobile phone, at the end of the day, if you don't charge it, it has no energy, it doesn't work. And it's the same sort of impact on our body. If we don't recharge our bodies, they don't work.
Without question, and that battery charger is the mitochondria. So there are receptor sites for specific things in mitochondria throughout the body. Mitochondria doesn't have a receptor site everywhere. It just lacks receptor sites in the blood vessels. But there's an interesting little take. The body's all interconnected. Mitochondria can, hitchhike on something called microtubulars in the blood, and therefore the mitochondria is literally ubiquitous in the body, communicating. So to stimulate the mitochondria efficiently is a full body exercise in health.
Yeah,
it will assuage many ailments.
I think this is what we're all here to do, and why we run so many educational workshops, is to try to keep planting these seeds of education. So we've touched on a few of these things already in conversations so far, Rob. The role of non-thermal high energy laser in longevity. How would you sum it up in a few sentences?
I would sum it up in one specific sentence. The health practitioner of the 21st century is one who uses low-level laser therapy. Laser energy is laser longevity.
Simple, yeah.
You know, it's funny how you say simple. It's funny how we're using analogies. You know, I do practice. I use this in my office all the time. You can see behind, I have an office. We'll do a hands-on to close the podcast, webinar, whatever you want to call it. I have found to really exemplify what you said, that the analogies vivify the concept of the laser light, because most people don't feel the laser, but they see the advantage, they see the end result, they see the increase in range of motion and the decrease in pain. But if they've never been to a practitioner before, to get an 80% decrease in pain in one visit, yeah, I'm supposed to get that. They're not. That's way above the bar. So you need to explain what's going to happen before and after, and if you do, the magic will occur.
Cool. Okay, next question, Rob. Could you review the link between mitochondrial dysfunction and neurodegenerative disease?
Yeah, I kind of touched upon about it before, that neurodegenerative disease is the backbone because of mitochondrial dysfunction. Mitochondria is an interesting idea in that, here's a couple of factoids, everybody. Now we get to nerd out. Mitochondria is the powerhouse of the cell, it's the battery cell. We all know that. But what we sometimes forget is mitochondria comes from bacteria in the gut. It communicates directly with the gut. Mitochondria has a strong secondary function of immune health. So that's very interesting, in that if you are attacked by a virus, like a COVID, if we could use that, a bad flu, and your immune system is working overtime, it's something called cellular danger response. Mitochondria senses that the immune system is on attack, it needs some help. It shuts its energy protocols, its energy producing centers, and goes to help in immunity. And that's why so many people feel exhausted during the flu. I mean, Simon, you had a flu most recently. You said, I lacked energy. all the charges out of your batteries. That's because
Yeah.
your mitochondria went to help the immune system. Now, what's interesting is that cellular danger response is a switch off. To turn your mitochondria on, you need 3 different steps: complex 1, complex 2, and complex 3. Nothing's more efficient than turning that back on than utilizing low-level laser. So the mitochondria dysfunction is really the backbone of a lot of our issues today. As far as neurodegenerative disease, it is all about mitochondrial dysfunction. Mitochondrial dysfunction occurs because it has a direct lay into the gut, and the gut actually is the origin of Alzheimer's, Parkinson's, MS. And even though I did a podcast on Alzheimer's yesterday, autism, it's also 90% of people with autism have a gut problem. So if you're treating gut and you're treating mitochondria, you are miles ahead of your competition.
It's something we hear more and more, isn't it? And you know, I'm predominantly these days tempted to call you Dr. Gut Health rather than Dr. Silverman, because you've always been huge, you know, on the gut. We've explained a lot as to why it's so important in previous conversations. Do you want to elaborate a little bit more as well, and also maybe elaborate on, you know, which light works well on the gut and what each light does with the gut?
Each one of the lights, wavelengths, so I'm going to refer to them as wavelengths if I can, non-thermal laser light or a wavelength. The 4 or 5 nanometer light, which is the violet light, is known to really help take care of bacterial dysfunction. So much so in America, they clean hospital surfaces with a 4 or 5 nanometer light. The green light also has a very positive effect on, believe it or not, viruses and fungus. So the green light is overlooked on having a tremendous effect on the immune system. It's one of the reasons why, as far as a handheld, the GVL is by far my favorite. Now, if you have an EVRL, don't throw it in the garbage. It's outstanding. And if you have an Accelerate, absolutely use it. But my Aston Martin, if I can use that term, my Aston Martin of the handhelds is the GVL. Number 2 choice would be the EVRL, and the number 3 choice would be the Accelerate. All choices above anything else. And thirdly, the red helps kill parasites. So when you put them together, could you hand me another laser? Just go in the other room. I forgot to stack my lasers, so I sent the boss to go get it for me. So when you stack them, meaning when you, thank you, when you put these together, when you put 2 lasers together, kind of like your rainbow reset, and you laser an area, or like the gut, if you will, you're now taking care of all the possible pathogens. So I've done some studies in my office where I've lasered people before and after a leaky gut panel, where it's tested for candida, zonulin, occludin, and lipopolysaccharide. The changes just using the laser are stellar. So the next step is to use a gut protocol. I have a 7-hour program, which is a little involved. You do your nutrition with the utilization of laser. Wow. And I'm going to definitely do a hands-on before we leave. We've got a few minutes. There's no rush. The hands-on are easy. Just so you know, the ways in which you can implement the usage of the laser are very simple, straightforward to use a hands-on outcome.
No, you've summed that up perfectly. Some of our customers already know this, but you know, we're trying to think creatively and try to think of a way how we could help clinics, you know, give their patients the optimum health. And I think what you've covered is, you know, if you use, for example, the red by itself, there's some definitive advantages. Green by itself, exactly the same as violet. But if you use all 3 together, that's how, to quote one of your terms, that's the secret sauce in optimizing what you can achieve from the laser to go with nutritional health and also to go with lifestyle changes.
Right, agreed. Well said. I love the term secret sauce. And we're going to cover this in 20 new protocols, hands-on, minimum of 20, you can count them. Probably the big takeaway is going to be tinnitus and Lyme. Those seem to be very popular protocols in Windsor.
Well, the good thing about Windsor, and I think there's some on this call that are coming, it's on the 2nd of November at the McDonald Hotel in Windsor, is that Dr. Rob is going to be sharing at least 15 of his new protocols, and this will all be specific to the longevity function, to brain health, to everything that goes into it. And you know, it's easy to explain examples so that you can actually take them straight out of here, as he said earlier, take them straight into your practice. So to look at various different functions within the Rainbow Reset program, we're talking about step 1, vagus nerve reset, step 2, brain and cognitive clarity, step 3, energy and immune recharge, which involves the gut and liver, which we keep talking about, the gut and the chest axis. And step 4 would be longevity and cellular vitality, which looks at the kidneys and the adrenals. So it will become clearer for everybody who comes to this event exactly how everything, you know, works integratively together. Dr. Rob's got his FX. Is it 635 or 405?
No, I got a 405 here.
Okay, the FX 405, which is.
So you call it out. You said vagus nerve, correct? So I'm going to do gut. So we start with the vagus reset, the carotid sinus.
For those of you that don't know, straight up in the middle of the FX405 is a red and violet light. To the left is one red light, and to the right it's one red light. So it's key to actually get the violet light specifically to the gut and also to the nerve root, as you're also looking to balance out the effects of the sympathetic and parasympathetic nervous system.
Right, so that right here, as Simon said, we've got in the carotid sinus. If you want to still stimulate the vagus nerve, most aptly, the right supraclavicular region is a critical element. In addition to that, the right auricular region is 1/100th the size of the vagus nerve. It has more nerve findings there. Those nerve endings lead you to a good outcome, believe it or not, with autism. And if you really want to go wild, you can do the right prefrontal cortex. But it is the right side right over here. So that's vagus nerve, neck and carotid. Now you have brain and cognitive. Vagus nerve frequency is 10, 10, 10, 4 tens. My master brain is 1, 10, 13, 40. 40 is a critical frequency for Alzheimer's, so we use it all the time. 1 also is very good for delta waves. 10 is vagus nerve, and 13 is for cerebellum. So I will laser my wife's brain. This is all part of the Rainbow Reset, or now we're going to call it the Rob Rainbow Reset. So we're doing the cognitive, energy, and immune. It's going to be doing gut and liver. Now, what's interesting about the gut and the liver is that this is the first protocol that incorporates gut and liver. Whatever you do to your gut, you do to your liver. Whatever you do to your liver, you do to your gut. The portal vein is a carrier of toxins from the liver to the gut. In addition to that, here's a question, pause for thought. What nerve innervates the portal vein? The vagus nerve. So this is why we start with the vagus nerve to help regulate that rest and digest nerve. And lastly, we're going to go down a little bit, go a little wider, and we're going to get adrenals and kidneys. So each one of these steps should take 3 to 4 minutes. I'm going to sit right over here. I'm out of camera view, but it'll be all right. You can see me getting lasered. So each one of these steps is 3 to 4 minutes. It should be a total of 15 minutes. This is a $150 reset program. You can do it once a week for a period of time. And then in your off seasons, you can do it once a month. You should be able to allow people to procure nutritional protocols with this laser reset. Or as I like to call it, it's the Rainbow Reset where light meets longevity. Now, I can't see any chat. Are there any questions on that?
Yeah, there's a few questions which I'm going to go through, Rob. I'll give this one to you because how I answer it as a company director and how you answer it can be completely different. Can the lasers be used on patients with pacemakers?
Okay, so here's the answer to the pacemaker question. The corporate answer that Simon's going to give is you're not able to do that because the belief is that the laser will drain the battery or could conceivably drain the battery with the pacemaker. In America, they're not called modalities anymore, they're called devices. Most pacemakers no longer have batteries. So the answer to the question is yes. I always err on the side of caution. I work with the cardiologist, and I haven't had a cardiologist to say no to a non-thermal photonic based laser.
Okay, thanks for that, Rob. I'm using my partner's Windows laptop, so I'm just trying to get through this. I don't need an answer today, but at the 2nd of November seminar, we'd be interested in discussing Ozempic and all of the health benefits that are coming to the fore. There's somebody called Tina Knowles, Rob, who's on Diary of the CEO and makes a lot of claims. Also, other articles on GLP agonists highlight their amazing anti-inflammatory effects.
Hold on, let's cover the GLP-1. You will see a laser protocol for GLP-1. It is probably the hottest protocol we have right now because GLP-1s are running rampant. In America, the GLP-1s now cost per month $1,349 as compared to $92 in the UK. However, with that being said, we have a protocol, a laser gut protocol that's outstanding, and I'll share a nutrition protocol with that. So you're going to have an option, an alternative. Sorry for interrupting.
No, it's fine. Rob, I don't know if you mentioned before about the frequencies for the gut. I know we said the 10, 10, 10, 10. What settings do you use predominantly for the gut? Was it slightly different to that?
Yeah, I do greatly appreciate the catch because I did not mention the frequency for the gut, my admission. Number one, here we go. Here are the frequencies for the gut. It's 4, 4, 9, 26. That's my Dr. Rob's master gut protocol. 4, 4, 9, 26.
Great. Thanks, Rob. Somebody's asking, will any of Dr. Rob's findings on gut health be published?
It's a good question. We've talked about it. I will share it with you in November 2nd. We've talked about doing it in a case study. I'm debating if I want to spend the time to write it out, to be perfectly frank.
Well, yeah, I understand you run a very busy clinic and all your podcasts and everything. That's finding the time isn't easy, is it? Somebody's saying, will a Windsor seminar be available on recording or similar? No, is the straight answer, because it's like a 7-hour seminar. We're also doing one in Belfast on the 31st, I think it is, 31st of October, the Friday, between 3 p.m. and 7 p.m., which we'll be going through a lot of these sort of things there as well. So if anybody can get to Belfast that day, it's easier than Windsor. Otherwise, we will be doing more webinars. We'll probably do a follow-up webinar to the seminar, and we'll obviously come up with some new dates for next year as well. Do you use these protocols, e.g. vagus liver, before or after chiropractic treatment?
That's a great question because you can do it before and or after. So I'm assuming chiropractic treatment is an adjustment. So I always palpate the patient when they come in, even if they're a nutrition patient, because I like to see what's going on. It's a great reveal to the tension in the body and the possible restrictions. So if I can get an adjustment then without any problem and with ease, I do it. If not, I'll laser them first. Remember, laser is going to decrease the muscle tone or the muscle spasm, so adjustment will be easier. However, if you laser after an adjustment, you're also going to hold that adjustment better. And one of the things that we're going to talk about is a laser motor lock-in where we laser the cerebellum. Everybody after any treatment, whether it's chiropractic, naturopathic, whatever, should always upregulate the brain. And the key component to that upregulation of the brain would be the cerebellum and the locomotor lock-in. So we'll show you that. We'll show you an advanced locomotor lock-in in Windsor. You know what we'll do, Simon? If they can't make it, we'll videotape that. You'll pull me in the corner, you'll film me while I'm doing that, because I think everybody should do that. I think if you have one takeaway, I think you've got to press the save button. As my wife has always said, if I work on the PowerPoint, I can lose everything if I don't press the save button. You can work on the body. If you don't press the cerebellum, which is the save button, the body may not remember all the good work you just did.
Yeah, well said. Rob, somebody's saying, do you use frequencies 4, 4, 9, 26 for liver as well as the gut?
No, the liver is one that's a little different, and I apologize. If it's just straight liver, it would be a different frequency. I'll have to get it. Guys, I wish I could tell you that I remember every frequency. I just don't have that total recall anymore. I clearly need to laser my brain a little today.
We'll send that out with the email that we send post-webinar, Rob. We can include it in there.
I'm sorry, I'll get it to you.
Can laser be used on the brain with aneurysm?
I mean, I don't treat aneurysm, so like I say, I always like to err on the side of caution. So I would not be treating the brain for aneurysm. Is it going to cause the aneurysm to burst? There's no data to show that. If anything, I like lasering everybody's brain as much as I possibly can, because laser stimulates what we call brain neurogenesis, which allows for neuroplasticity. It also enables people to have a better proprioceptive feed. So I think it's one of the biggest turnarounds. There's data that we have, and I know you have the articles to talk about laser with autism as well. I think lasering the brain in a non-thermal photonic energy light is a secret recipe for success.
Brilliant. So for somebody with diverticulosis, have I pronounced that right?
Diverticulitis is the way we say it. Who knows?
Okay. How often would you suggest the gut protocol to be applied?
For diverticulitis, I would do the gut and the inflammation protocol. Simon, you can pass on the inflammation. I think it's 9, 16, 42, 72 is my frequencies for inflammation. And if you can, I would do that every day if they're in acute stage, which really begs the question. And I know you guys don't do it as much. I have anywhere from 5 to 7 lasers out on rental per month. So I'm a big believer in renting a laser if a patient can't make it every day when they have something like a diverticulitis, which is usually awful when it's in an acute stage.
Okay, thanks, Rob. The question that's come through on my other phone: can you over-treat the brain with non-thermal high-energy laser? For example, could I treat myself for 10 minutes, and would there be any repercussions? And does the treatment time depend on which wavelength has which higher or lower energy levels?
So it's really a twofold question. Number one is you can't laser your brain too much. 10 minutes certainly would not be a maximum. That said, think of it like this. So if you're going to laser for 10 minutes with the Accelerate, you're going to laser half the time with an EVRL, and then again another half the time, in my opinion, with the GVL. So they all work well, but they all work differently in that they work differently, and that is the biggest thing. It's the time element. The GVL is much faster. Like I said, think of the Accelerate as a Toyota. It gets you everywhere. It's great. It's a beautiful car. Think of the EVRL as maybe like a Mercedes. It's fast, it's sleek. But think of the GVL as the Aston Martin. There is no other substitute.
And the reason why Dr. Rob's saying that as well is we discussed earlier about the amount of energy per photon. And the red delivers approximately 1.99, green 2.33, and violet 3 electron volts per photon. So when he's saying 10 minutes on the red is because there is less energy per photon, so you can go on for a bit longer. 5 minutes with the red and violet because the violet is a lot more energetic, and the green and violet is the most energetic, so again, half the treatment time. So there's no point in over treating if you can do it with the GVL, green and violet, for 2.5 minutes. there's no need to do 10 minutes.
You know what we found out, which was fascinating, you know, and I've been doing this over 15 years using lasers on myself in my practice, and, you know, nearly 15 years on treating. The treatment times when we initially started were much longer, and the advances in laser really made them much more efficacious and expedient with reference to time. And, you know, it's exciting because you can have a wow factor in 5 to 10 seconds. So just remember, you know, you're just dosing. If you want to get a quick mitochondrial function, you may point and shoot if you're looking to get a more healing aspect. But again, to emphasize what you just said, the decrease in time is vast. So a lot of the books out there, you'll see 10, you'll see 20. For instance, the FDA clearance for the FX635 for lower back was 20 minutes. I was the first one to have an FX405, and it was 20% more effective in half the time. So that was 10 minutes. Now it's 10 minutes conceivably maximum for lower back. We usually do 5 face down and 5 face up. So look where we went from 20 minutes and an FDA clearance to 10 minutes by switching out, or adding, I should say, a violet light. And now we're actually taking the same time, but doing front and back and getting a more eclectic enhancement from photochemical responses.
Okay. Part of the question was also the repercussions. If you were to overdo it, I mean, you know, I think that's explained.
I'm going to inflect my opinion now as far as overdoing it. You would need, with lasers of this power, if you will, 440 continuous minutes to have a detrimental effect. The only problem is that would be if it was a continuous beam. We know that it's a 50% duty cycle, so it switches on and off, on and off, and on and off. So you have nothing to worry about. You are not going to hurt anybody. That's the hot lasers. Those are the LEDs. So
and infrared-based devices as well. I don't know if it's reaching over there, Rob, but there's certain, I'm not going to mention certain brands of infrared laser, which obviously, as you know, 700 nanometers up to just under 1,000, that are actually treating the brain. And there's doctors advocating that. And I'm not a doctor. I don't understand the physiology and anatomy like you do. But if it's me, I'm like, what the hell? Why would we be using any heating device on the brain?
It makes no sense. Did you see the movie Men in Black?
Yes.
I think, right, where a guy went, every time I see them do it, I think somebody's hemo head is going to explode. It's nonsensical. You know, just because somebody does it doesn't make it right. And just because someone is a doctor doesn't mean that they're doing it right. For me, it's an egregious act.
I also think as well, it's very important for lots of the clinics and practitioners out there, especially in Europe, to look further into the quality of the clinical evidence, because, you know, I always say, and I say this if ever I go to events with the team, you know, if we're in an auditorium and there's like 300 people there, I could handpick the ones I think would actually respond best to a laser treatment, and I could publish it and the results would look out of this world, but that's not real life. And that's why a non-randomized study is the most important, because these patients aren't being handpicked. And every result you'd probably see would be like that, because each of us as human beings, we have our own frequencies. So we're not all going to respond the same way.
Agreed. You know, as we see the finish line to the webinar, I don't think any of the practitioners out there, when you put it the way you did about heating a brain, nobody wants to heat a brain. I mean, you know, it's interesting. We do something called hormesis in life, which is a slight stress to the body, kind of like a sauna for a little bit of time. But the temperature never gets too high. It should be from 146 to 174, but not heating your brain. So it should be more of a tent. Cold, it should be 50 to 59 degrees for a short period of time, because that light little stress to the body enables the body to release something called heat or cold shock proteins, which are very salubrious to one's overall health. However, heating the brain just a few degrees, that's a fever. I mean, Simon, you have children. Everybody has a child, a niece, a nephew. We all know if we go 105 to 108, it's game over. I'm only looking about 6 to 8 degrees. It's just a nonsensical act. It doesn't work. And it's one that I wish everybody would just take off and delete on Instagram.
Yeah, I wish the market was more regulated so that something could be done about that. I mean, we over here, we have a company who involve who have a technology specific as TMS for the brain, which again, would I use that on my brain? No. If I were to use it, I would probably expect to maybe suppress small symptoms. But here we're talking about making wholesale changes at a cellular level and to the mitochondria, so these symptoms don't even happen in the first place.
Indeed. I mean, that's going to be my answer to you on that, indeed, without question.
One last question, because I know you've got to go. Somebody said, I've been looking at the Erchonia handheld lasers, but would I get a better response using the bigger lasers, which they obviously mean the FX series, which have more diodes and presumably deliver more energy?
I think they just gave themselves a terrific answer. It's almost a rhetorical question. Yeah, sure. You know, don't throw the baby out with the bathwater. The handhelds are stellar. However, the FX is supreme in that you will have more energy because you've got these diodes and you're also getting more in area. So let me show you what I mean. I don't think people realize that so can you see the surface area that it's covering?
Oh, that's it. Yeah, we've got you now, Rob.
So look at the surface area that it's covering. So it's going to cover a wider surface area.
You can't really see. You got to sit the other way. Or... No, you're good. Yeah.
We're doing better?
Yeah.
I wore a black shirt just in case. So I'm getting a little work on my abdomen. I appreciate it. Thank you, Sally. So you're seeing it's covering a wider surface area. It has 4 diodes, whereas that one has 2 diodes. So the answer to your question is the FX is supreme, but the handhelds are stellar. The secret sauce, as I like to use, is the 635, excuse me, the 405 nanometer FX and a GVL, because that's where you get all 3 wavelengths. To me, I call it the 1 + 1 = laser success.
Yeah, I agree. One quick more question that's come in. Do you know the difference between infrared laser versus infrared sauna therapy, such as goal implications, brain effects?
Yes, that's a great question. So I have a far infrared sauna. I use the LED to heat my body. It's a tent. So in theory, I can have my hands out so I can watch TV with my phone, or I can text and WhatsApp with Simon, but my head is out because any one of these saunas is typically too hot. If you go up to 200 degrees, which is very easy to raise that temperature quickly, you can damage your blood-brain barrier. So again, it should be a low temperature, and that infrared laser stimulates heat in your infrared sauna. So that bodes a question of what do I think of the red light rooms? Listen, if you want to fry up your stuff and make it scrambled eggs, if you will, God bless. Now, mind you, I have an open invite to anybody to come on my podcast in any of those companies, and I want to ask them the question and go over the data, and nobody has responded favorably to come on yet, just so you know. So it's rhetoric. It's not hardened, hardened stone fact, if you will.
Yeah, definitely. Rob, would you treat a patient who happens to have non-active sarcoidosis on extremities for nerve and capillary regeneration?
I don't treat a lot of sarcoidosis. I just don't see it, but I don't see it as a contraindication of laser.
Well, it's not classed as a contraindication. Somebody else has said, would you please also send protocol frequencies for adrenal and kidney portion, which we can do in the follow-up emails, so don't worry about that. And I think, Rob, I know you've got patients to go and see, so please, anybody else who has any further questions, please email them. You will receive an email tomorrow from one of my team, just covering different things, providing the recording to this this webinar. So at this juncture, Rob, thank you so much for your time. Sharing your knowledge and your expertise is always hugely appreciated across here. And guys, all I can say is if anybody can make it to the 2nd of November workshop that we're doing at Windsor, the McDonald Windsor, please be there. It's marked this continued professional development as well. So there's a double whammy, but you will learn so much. And I'll finish off by saying it doesn't matter what technology or what technique anybody uses, it's all about the patient at the end of the day. So let's do what we can to provide our patients with the best treatment. Whether we buy it or not is immaterial, but it's at least understanding it and understand how it differs to what you do have. So at least be in the position of knowledge, because what did my dad tell me? Knowledge is power.
Without question. Jim Rohn said, take care of your body. It's the only place you have to live.
Exactly. That's another good one as well. So Rob, thanks very much again. Really appreciate it, and look forward to seeing you when you come over for Belfast and Windsor.
I can hardly wait. I'm curious to see if
thanks
they can
everybody
guess
for your time. Really appreciate it. Bye-bye.